Everything we do in our everyday lives is driven by an innate desire to live and to make the most of life. So it is rather poignant and despairing when one is confronted with the choice of death as the only escape from life suffering. As professionals, we work with service users who battle the seductive power of death every day. As members of society, we watch with helplessness as the story of someone seemingly well and happy and perhaps even popular gives up by taking their own life. As friends and relatives, we might have stood next to someone to pull them back from the brink or to hopelessly watch them taking their own life. Whoever we are, we may have been exposed to the unbearable reality of someone being pushed to take their own lives. Whoever we are, we see this as a community that we are a part of as individuals, professionals, and organizations. Regardless of who we are and the organizations that we are affiliated to, we work together and we have made steady progress in coming together to create that space of hope and safety. And that work we do does get tested now and then through individual stories and events on a global scale like this pandemic. COVID has tested our society in many ways. It has challenged our health, our economy, our social fabric, and most of all, our psychological health and resilience. And we have felt the sadness hitting us in waves of news stories and stories of people who we once knew and who have now sadly left us. So, what do we do to renew our sense of purpose as individuals, professionals, and organizations? As individuals, we shall choose to connect and reach out and know that safe physical isolation does not mean loneliness. Whatever it is that we might do, a smile and a wave, a telephone call, a video call, a random act of kindness, whatever it is that we will do it and place faith in that old adage, knowing that the true source of happiness lies in growing happiness in others. As professionals, I am humbled by the great work that's done by colleagues across different sectors. The work that people do in communities, the voluntary sector, the transport services, the police, the ambulance, social services, and colleagues in healthcare. I'm particularly acquainted with the work of colleagues in LPT, and I've seen how we as professionals battle the odds to nurture human empathy and professional curiosity. We balance autonomy and respect with risk assessments, and at all times further our own development to become more effective and compassionate at what we do. What are we doing as organizations? Within LPT, we understand our responsibility as a statutory provider of mental health services. As part of this responsibility, we give this area of work due importance with two broad approaches. One is by ensuring we create a learning organization that our staff can benefit from, and two, by creating organizational governance frameworks that ensure this area of work gets the due importance it deserves. As an organization, we work with colleagues from statutory and voluntary partners in LLR to create a more safer and responsive community. We work very closely with other organizations, regionally and nationally, through the Zero Suicide Alliance to learn from great work being done elsewhere and to showcase some of the good work we do here in Leicester, Leicestershire and Rutland. As LPT, we are committed to three areas as priority areas in our work to support this area of preventing the risk of suicide. Firstly, the focus is on prevention. We have worked to create a resource of positive mental health and well-being available to all communities in words and languages close to their hearts. Keeping the focus on prevention, we have risk assessed and risk stratified our service user population in the community to ensure that our most vulnerable service users receive support and attention promptly. We've invested in making sure our hospitals are safe from the risk of suicide by adopting research informed by the findings of the National Confidential Inquiry of Suicide and Homicide and frameworks designed by the Royal College of Psychiatrists to keep mental health inpatient units safe from the risk of suicide, and we take pride in being able to do so. Our second focus is on learning and development. We are creating opportunities and space for reflection in learning, where frontline staff can learn in an open and honest learning environment, and where governance stimulates and supports learning. To this end, we have invested in suicide prevention and learning groups as part of our governance framework, and conversations from these groups travel all the way from the front line to the trust board. Our third approach is to work with families and carers more effectively and compassionately. This means working better to keep their loved ones safe by balancing the right to confidentiality with the privilege of working together to create personal safety plans. This means working together to investigate and understand what happened when, despite our best efforts, someone does end up taking their own life. This means us being there to offer support and share the suffering of loss and bereavement. In Leicestershire Partnership Trust, we are committed to progressing these approaches as the core of what we do as a response to the ever-present risk of suicide. We are mindful that our efforts are only as good as our measures of success, and we are mindful that every life lost to suicide is a reminder of how long the journey is ahead of us. Our promise has to be the unflinching effort and the resolve that we, as individuals, as professionals, and as organizations, will work together as a community to give hope from darkness and despair to our people and our families.